This is Scott Becker with the Becker's Healthcare Podcast. Thrilled today to be joined by long-term leader in healthcare, Michael Patterson. Michael's the president and CEO of Mississippi Valley Health, located in sort of the Quad Cities area of Iowa, and he'll tell us if I've hit that right or not. Michael, thank you for joining us. Can you take a moment to introduce yourself?
Thanks, Scott. Happy to be here. It's an honor to be able to talk with you on a podcast, and excited about discussing what's going on in today's healthcare world.
And tell us a little bit about your background and sort of the evolution of Mississippi Valley Health. I want to talk about how strategy is evolving over the last couple of years.
Sure. So me personally, I'm a ER nurse by background. I spent approximately 23 years in the U.S. military, retired, and then took that learning and moved into the civilian sector, and have been a leader at both large health systems as well as ASCs. And I've been a chief nurse executive, chief administrative officer of a 350-bed hospital, and currently reside here at Mississippi Valley Health. This is a great entity. At one time, it was a physician-owned entity for many years, and then over the last 5 or 6 years, we've created some partnerships. But we have a very large multi-specialty ASC doing outpatient total joint and spine for the better part of 15 years now. We have a separate endoscopy surgery center. Really a great group of providers in that facility, as well as a pretty robust real estate platform and a network of physician specialty clinics.
Fantastic. And talk a little bit about any leadership lessons you learned from the military that you think of in your daily life today in practice in what you do today.
I think the biggest thing we learn is that if you don't take care of your people, they can't take care of you, and they certainly can't take care of patients. And whether that's in the military or on the civilian side, I think that resonates with a lot of folks. And I truly enjoyed my time both at the bedside and in leadership roles at my time in the military, and really enjoy the opportunity to serve other people and improve the patient experience, improve a work environment, and I think when all that comes together, a lot of really good stuff happens.
Well, I tell you, I'd be remiss in not saying thank you for your service, both in the military and in healthcare. So thank you. And Michael, let me ask you. Next question is: last couple of years have been really a challenging time. Really, hopefully a once in a generation, a lifetime time with this COVID and the pandemic. How has strategy changed at all through the pandemic? What are you seeing? Is it just operational changes or strategy changes? What are you seeing?
Well, I think it's a little bit of everything. The pandemic hit us, a little over a year ago. And at the time when all that, came about, we've got, national directives, you've got state directives, you've got local directives about what we could and could not do. And we went from, the ASC industry, which just continues to thrive, to now how do we survive as most ASCs are small businesses. And, first and foremost, if you don't take care of your team, take care of your employees, you won't be able to take care of patients, won't be able to serve your providers. So we really focused our strategy on how do we retain folks, how do we make sure that, they're safe to care for patients, and how do we also follow the directives from the state and local healthcare leaders. So a lot of direction, a lot of time was focused on that, which would normally be spent on how do you grow the business, how do you bring in, new surgeons, how do you increase market share, how do you decrease costs and improve quality. So that changed a little bit. Those things are still there, but I think really at the forefront was how do you keep the doors open, how do you serve the appropriate patients in the appropriate setting, how do you make sure you got supply chain, and how do you keep employees and patients safe, all while doing that. Really was, how things have changed over probably the last, 12 to 18 months.
So much goes into, and it's really the same throughout your entire career, taking care of your team, taking care of everybody so that they take care of the business, take care of the patients and everything else. What are your top priorities this year? When you look at this year, Michael, how do you look at your top priorities this year?
So for this year, given the current situation with, trying to find employees and and supply chain, I think our big focus is how do we retain and retain the talent that we have and recruit new talent to ensure that we can provide, outstanding care to patients. How do we do that not only with a staff level position, but also our providers, our physicians, our anesthesia providers, PAs, nurse practitioners, those types of things. I think you have to up your game and ensure that these people know that, we care about you as a person and we want you to be safe and we want to make sure that you have a place to come to work and that we've got patients to take care of. And so retain and recruit staff and providers is a big piece. I think the other component of this is how do you do it safely, given all the changes and now we've got the vaccine out there and how does that change and how do you make sure you're up to date on the latest, recommendations from the CDC and your state and local governments. I think the other thing is what we did recognize during this pandemic was I think supply chains can be rather fragile, depending on where you're sourcing product from, really cementing your relationships on the supply chain. And then if you get something from one place, what's your backup plan if that particular vendor or provider can't, send you things. So I think that was the other big kind of lesson learned was supply chain management, how important that is, because I think a lot of times we just took for granted that, gloves and drapes and gowns and everything in between masks, would just show up when we ordered it. And that wasn't necessarily the case. But I think really focusing on that as well will be a big deal. And then how do you, now that we're working through some of this, we got to get back into growth mode. And how do we maintain what we have and continue to grow it? And I think another great lesson that we learned was how do you implement technology faster, better, smoother? And we really use technology to interact with not only our patients, but our providers. And we stepped up some of our timelines on some of that technology that's out there and how do you get your staff trained in how to use it, your providers and the patients. And that really did help us in the communication component of how we work with patients.
And talk for a moment, Mike. I mean, so much effort on supply chain, retention, recruiting people, taking care of your core team so you're here to keep on thriving as the pandemic rolls away. Talk about what you're most excited about this year.
So this year, we are fortunate. We've acquired the Mako robot from Stryker. We recruited a surgeon from the California market who wanted to move his family back to the Midwest, who's done hundreds of these cases, and he actually worked with our current total joint surgeons, and they're all trained. In our first 90 days, we did over 100 total joint replacements using the Mako robot from Stryker. And I think that program is just continuing to grow as patients really understand what that means and what the differentiator of using a robot and some of the new technology means for, total hip and total knee replacement. So that's one piece. And then the surgeon that we did recruit, he also has, he does a very unique, what he calls a cosmetic hip replacement, which is kind of interesting. Instead of having this, this long scar along your hip, he does it along the bikini line. So that way you can't even tell you've had a hip replacement for those people that are concerned about that. And, one of a handful of guys that are really using that routinely. And so I think use of the Mako, a new surgeon, and basically a new procedure that he's brought to the market. And we are already recognizing patients traveling from all over the country and the world to come here to our facility to seek out this kind of treatment. So it's a really exciting time here.
That just is magnificent. How long have you now been with Mississippi Valley Health?
So I am going on my 10th year now here at the end of the year.
Fantastic. For some reason, it seems even longer than that. But what a remarkable ride and growth you've had in institutionalizing it and professionalizing the organization. What a great job you and your team have done. Michael Patterson, always a pleasure to visit with you. You talk at a more thoughtful speed than you drive at, and it's great to get to visit with you. Thank you very much.
Thanks, Scott. I appreciate the opportunity, and I'm humbled by what the teams have been able to achieve here, and what we continue to look to achieve here over the next several years. So it's a great opportunity, and I always appreciate some time to sit down and chat with you and hear what's going on with you as well.
Fantastic, Michael. Always fantastic. Thank you very much for joining us again.
Thank you.